name is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Hello, and welcome back to the Digital Health Heavyweights podcast with your host, Norm Volsky. And we are very excited to be joined by John Quinn. John is the founder and CEO of Wellnessity. John, welcome to the podcast.
Norm, thank you for having me.
Absolutely. So we're really excited to have John on. For all of those that are unfamiliar, with John, he's a published author of Benefits Revolution, the next generation of employer-sponsored healthcare. John is widely regarded as a thought leader in the healthcare space. He firmly believes that a healthier business is built on smarter healthcare for employees, and that data is the key to driving this transformation. Under John's leadership, Wellnessity developed the groundbreaking Smart Hub platform, which leverages advanced data integration to simplify health plan management. By connecting disparate vendors and their data sources, Smart Hub enables organizations to measure ROI objectively, uncover significant savings, enhance member engagement, and reduce fiduciary risk. Prior to funding Wellnessity, John spent 25 years in consulting at Anderson Consulting, Diamond Technology Partners, and McKinsey & Company, where he worked with global 1,000 companies rapidly scaling up in the business world. And we're really excited to talk things all Wellnessity and benefits.
Wonderful.
All right. So, John, I'm really glad to have you on. What inspired you to move into the healthcare field?
Yeah, that one's fairly straightforward, maybe a bit naive. So I grew up in financial services, both trading and payments. And for me, about 10 years back, those industries worked and healthcare and health benefits were not working. And with nothing
Do they work now?
There's a lot of people trying. So, we're...
Us two included.
Yes.
Very nice.
So anyway, with no other motivation than that, it was kind of a go west young man, solve a new problem.
All right. And with 25 years of management consulting experience, what were some of your greatest accomplishments and learning opportunities, in those formative years?
Yeah, so one of the interesting things, Diamond was a cutting-edge firm back in the late 90s, and it was one of the first firms that brought really technology and business strategy together. It's pretty commonplace today, but one of the key changes that occurred back then was the arrival of the web. Mm-hmm. And with the arrival of the web, we had a lot more reach in the sense of how we distributed products. We also had a lot more knowledge for the first time about consumers and could talk with them directly via a web interface. And we had this idea that, quote unquote, network economics really increased the set of product options that consumers had. And it also increased the number of suppliers who could access those consumers. And we've brought a lot of those principles into healthcare with us.
Yeah, and in your time in consulting, it sounds like you worked with some healthcare systems. Can you walk us through how those interactions built your opinions of the healthcare system and partially its flaws?
So interestingly enough, I did not work in healthcare systems.
You did not? Interesting.
Yeah, so I was very much a financial services person through and through. Two things happened while I was early in my career. One, we did away with a lot of the bricks and mortars of banks. Mm-hmm. So banks used to be like insurance companies and hospitals in the sense that there were big office towers in every city. And we figured out that those office towers didn't actually pay for themselves. Mm-hmm. And we reconfigured the whole banking industry during the 80s and 90s and made it more efficient. The other thing that we did during that era is we digitized a lot of the paper that was out there in banking. If you guys remember your checking accounts and you remember trade tickets and you remember passbook savings. During that 20-year period, we converted everything to digital. And once we converted to digital, we were able to efficiently move products and services around the globe. So your ATM being slid in everywhere, your account balance being available everywhere, your mortgage being serviced, while you were on vacation. All those were things that arrived early in my career. When I came into healthcare, I was surprised at the mess of data, the islands of data, the lack of really interconnects or sharing. A lot of folks have said that healthcare is so much more complex than financial services, but I would push back. If you're tracking molecules coming out of the ground in one part of the globe and they're bought and resold 20 times before they're consumed in another part of the globe, it's a pretty complex system. So we've brought a lot of those ideas with us with Wellnessity. One of the things that happened when I was in financial services is we got rid of the data warehouses. Not completely, so they were still out there in the back office, but we learned that they weren't very good to support front office decisions. We had a kind of pithy quote back then, which is data warehouses are where data goes to die. We also had a perspective on reports, and reports or reporting was always last year's news. And if you kept building reports, you ultimately recreated the needle in the haystack. So if I've got 400 or 500 reports, it doesn't do me a lot of good if I don't have the time to look through them. So Wellnessity has avoided a lot of the pain of data warehouses, making data more accessible, and we abhor or hate reports. We prefer to have activity that is pushed out to people so that they can take action on it, rather than forcing them to go look through a pile of reports to see what they should do next.
Very cool. And can you tell us about specific rapidly scaling startups that you worked with in your consulting career and how you learned from those and what maybe you apply some of those lessons to building your business at Wellnessity?
Yeah, so I had the fun experience of creating new products or new businesses inside of large corporations. So at Goldman Sachs, where I worked for quite a few years, we would create new products in the space of 30 days, and we would stand those up in a new division with a new risk segment, in 30 to 60 days so that we could be out in market and meeting client needs. We've taken the same concept with Wellnessity, which is how do we create really narrowly defined products? We call them performance levers. And those really encapsulate different ways that we can save health plans money and beat the trend curve. So it's about being focused. It's about having the data in an easily manageable format. And it's, for us, one of the things that's been very interesting is it's about connecting to point solutions that have the expertise to deliver something of value.
Yep, love that. And talk to us about what inspired you to found Wellnessity and tell us about that origin story.
So Wellnessity in the world of startups is what you would call a fast fail.
Okay.
And what I mean by that is the Wellnessity that you see today in the marketplace is actually a 2.0. So one of the reasons we're called Wellnessity is our first solution was population health. And we were focused at businesses under 50 employees. And this is
You've
right
worked
around...
your way up over the years.
Yeah. So what I had was, they have them out there now, the cafeteria plans. The IRS has gotten a lot more friendly towards them. When we got started, it was a bit more uncertain. And I knew I had an issue when I had 10 business owners all saying yes, but I couldn't get them to step off the starting line and actually write checks. So we started to go up market, and as we talked to more senior executives in larger companies, they said two things. A, we don't know if population health pays. So we would discourage you from going into the wellness management business. And B, you're onto something with healthcare because it's a raging inferno of cost overruns, and it's putting me out of business. So as any startup entrepreneur will tell you, anytime you hear that kind of pain in the marketplace, you stop and listen and say, maybe there's a business there. And when we actually did the research and found out that it was the second or third largest expense, and it had been going up at 5 to 6% per year for 20 years, we knew we were onto something big. The kind of real jumping off point for us was when I asked the C-suite executives, well, okay, I understand it's a big problem. I understand it's very expensive for the business. Tell me a little bit about the information you have to guide your decisions. And they went, we don't have any. And I went,
sad but true.
Yeah, what do you mean you don't have any? And they said, well, the suppliers have it, the PBMs have it, the carriers have it, my advisors have it, but we really don't have anything that we trust. So that was Wellnessity 1.0, was creating a data utility that was right-sized for a single business. We position ourselves really as, how do I serve an employer first in a market where the suppliers have all the power?
Yeah, that's right. Very, very true. And walk us through a little bit more how the product has evolved. So, you told us about the first iteration, then the second, and just what has been enhanced since, that first version too.
So the very first thing, as you mentioned, is making data easy. Not only, did we know it was important, but we were surprised at how hard it was to get it from the ecosystem. That's been part of our secret sauce. We literally have 100% success at getting data out of the ecosystem. The second thing that surprised us was the lack of financial controls. So most businesses have a very strong payables function, right? Most of us would consider that a basic ingredient to run a good business. Unfortunately, when it comes to healthcare expense or health benefits, people don't really understand their payables. So basic things like, are these people still enrolled? Are your invoices in line with your contract terms? Are your invoices in line with the claims detail? Are the rebate checks that you get actually supportive of the rebate contract or the pharmacy contract? And we just found errors everywhere in the system. We're actually yielding about 1 to 3% each year in repetitive financial errors. The third thing, which is the most fun for us, is really unbundling health plans and helping point solutions effectively serve a health plan. And the way that we tackle that problem is we integrate to each of those point solutions with data. So we implement them only once. We're not implementing them over and over again each year. And that third layer is, our highest source of value and typically gives us another 3 to 4%. So if you add all that up, we're beating trend by 5% every year for most of our portfolio. In fact, I was just given some data from my team a few days ago. Our average cost is across our portfolio with 500,000 lives was $12,500 per employee per year. That's quite a bit below the Mercer numbers that are out there at 16,000 and headed towards 17,000 next year.
Great. And walk us through the company mission.
The mission is really to help employers deliver better benefits, benefits that are affordable, health benefits that are affordable. And the key things that we try to do is route people to higher quality health care. And one of the interesting things is that it's usually lower cost.
Yeah. And why is that the case?
Well, you have to pay for your errors. So in U.S. healthcare, most of it's a cost plus system. So if you have a hospital that has a higher error rate, that hospital has to recover the cost of their errors, and they're going to charge a higher price. So one of the most interesting leverage points that we've discovered is if I can get people to a higher quality doctor or a higher quality hospital, the cost goes down.
I love that. And let's talk about company building, because you built just a fantastic company. What traits do you look for when you're hiring really crucial roles for the company?
If I had to do it again, I would do it differently. I think if you ask most entrepreneurs, they take away a few lessons. We started with young, really smart people because we didn't even know exactly, this is 8 years back, what the problem looked like. So I wanted really smart people that were flexible and could move right or left. They've been wonderful, and a lot of them are still with us. If I had to do one thing over and over again, I probably would pay higher salaries and go for more experience earlier.
And why is that? What do you think experience, achieves for an organization that's early in their growth?
Yeah, it's efficiency. So that learning curve's expensive, and if you can get somebody with the right mind that's motivated to do things differently the next time, but they have the benefit of past experience, you really get, a powerful person to help you, go take the hill.
That's fantastic. And that's great from an experience standpoint, what you look for. What about traits? What about like personality traits and
Curiosity.
build culture?
Curiosity is probably number one. Willingness to collaborate. Especially if the problem's ill-defined. We don't want people that sit in a cube. We want people that are kind of reaching out and helping other parts of the organization learn or solve problems. So I think, that curiosity and the willingness to collaborate are big. The third is, to be willing to make mistakes and not be afraid of those mistakes and learn from them and keep going. And then you've got all the basic, good verbal communication, good written communication. Data analytics skills are pervasive for us. So probably 80% of our firm is very conversant with things like Tableau and SQL and other tools that are becoming, mainstay for modern business.
I like it. What have been your greatest successes so far that you're most proud of the team for?
I think early on, figuring out how to actually talk about the solution, it's really, we didn't take an existing business and extended it. We started with a blank sheet of paper.
Yeah.
And with that, we really had to learn how to talk about it simply. It's when you're solving problems early, you tend to overcomplicate, and we made all of those mistakes. I think getting to a point where we can talk to HR leaders and talk to vendor leaders about the basics of good, clean data helps. Higher frequency data helps. Taking care of the financials of the plan provides hard dollar cash and real ROI. Then,
It's a rare these days.
yeah, and then realizing that these point solutions, a lot of them work, but they can't work in isolation.
And why is that? And why do you believe that?
So first, if you talk about point solutions, they tend to be below the fold as far as top five, which means they're a little bit on the weak end of the spectrum as far as their power. And as a result, they can't get the resources they need. So they can't get the data they need to do their job well. They can't get the approvals they need to market and build awareness. They can't get the information they need from the rest of the system to actually show where they're successful and where they have gaps. And ultimately, it's hard for them if they don't have good data and they can't see the other part of the system will wait for them. They can't calculate their ROI.
Yep.
So helping them close those gaps has been a lot of fun.
That's great. What are the biggest blind spots self-insured employers have in today's climate, considering you have access to the data many other people don't?
Yeah, unfortunately, the new regs around fiduciary duty are getting more and more teeth, and the litigation is starting to gain momentum. And there's real financial jeopardy or financial risk if these employers don't cover off on their fiduciary duty. If you look at what the regulators want, they want the employers to take access to their data. They want those employers to demonstrate that they know what's going on inside the health plan. and they want those employers to take action on what they're seeing. So the days of kind of holding your hands up and saying, I don't know, I don't know what to do, I just write the check, are kind of over. So we're capable of helping employers. We can get the data for them. We can show them where there's issues. We can show them where they can take action. And most importantly, we can show the results of them exercising their duties, which we think is a pretty powerful defense if anybody ever comes knocking.
Yeah. And data is at the core of your model. How does Wellnessity ensure accuracy, integration, and actionable insights?
So accuracy is really, really hard. If you've talked to anybody that's messed around with the data, our data engine is a 7th generation data engine. It is one of the hardest problems that we've had to solve. We are on the verge of being able to take a brand new data source, and with the help of AI, believe it or not, generative AI, we can actually build the map to bring it into a normalized model in 2 hours. So we fundamentally changed the economics of data intake. And what we're doing is we're having our people spend more time on accuracy and less time on basic intake. On the integration front, the other thing that's happening is we set out to build connections once and only once, so that we don't have the spaghetti that exists out in many places in healthcare where it's many to many. There's batch files flying around everywhere instead of one kind of industrial strength connection. And that's just the raw ingredients for us to then have impact on health plan performance.
Okay. And explain your proactive benefits management system and how it's able to achieve $2,000 cost savings per employee on their health benefits, which jumps
It's a big
off
number.
me. Yeah.
That's a big number. One of the stats that I will give you, I think I mentioned it at the top, our average portfolio cost per employee is $12,500. The Mercer numbers are at $16,000. So right there's your kind of macro evidence that the portfolio is beating the market by $2,000. The way that we do it is if you get good data, and in our case, we're trying to get new data daily. So we get claims daily for both pharmacy and medical. We get enrollment daily, which means we know what's going on with, let's say, somebody got to do cancer diagnosis, or somebody needs to get an image, or somebody needs to get spine surgery. So what we're really doing in the active management is, as new data arrives, we have triggers. So the machine is watching for situations or patterns that it understands. And the second the data arrives, the trigger goes off. And we're alerting a point solution that they have a new member that they need to engage with. And we just suck up we talk about it. It's not a top-down design, of the plan. It's not a top-down contract negotiation. It's actually a bottoms-up. How do I suck up all the quarters and nickels and dimes of savings that generate the $2,000 in annual cost savings?
Yeah, and the company delivers significant performance improvements by combining real-time analytics and driven insights. Walk us through a performance improvement that your team helped pinpoint and act upon for a client.
Yeah, so what we do, we talk about, typically is about a 3-year maturity cycle with most of our clients. The first thing that we're doing is we're showing them the value of getting good data so that they can evaluate the vendors they already have. Once we do that, we help the vendors size the savings goal. It's a very different, it's not a top down, it actually says, if you had put this in place last year, this is how much it would have saved you. That's what we think about when we call it a performance assessment. We not only do it for, let's say they have 3 to 5 point solutions in place, we'll actually give them a map of 10 to 15 other items where they could save money. And what happens is you start to go on a journey of like, okay, I helped this vendor A perform better. Now I have more time. I'm going to bring vendor D onto the table. Our average is probably 5 to 10, as kind of the range that feels like a normal state for a smaller company. The average size of companies we serve, the median is 2,000, so we have a lot of small ones as well. And what we're really trying to do is make it easier for the HR team and the advisor to keep track of all the moving parts so that they can have confidence and deploy more of these point solutions and save more money in the future. But that whole performance assessment is that sizing each strategy or vendor as to their potential savings and then managing them towards that goal.
Yeah. All right. And are there any surprising insights, that you have uncovered for your clients, and what caught you by surprise the most?
I think surprising insights, it's a big wild west. I think one of the consistent things that is hard that we work on is low engagement. We have had early on when we'll hook in with a vendor, they'll be saying, hey, I'm going to save you 6%. I'm like, but you're only engaged with 3 people. Or, hey, we're really good at managing cancer. And we're like, we've got 30 cancer patients and you've only talked to 2. So I think over and over when we start, we're kind of surprised at how little the engagement rates are and how little people understand about what to do to make them better.
And what type of improvement on average do you see once?
Well, I'll give you a case. It really, really varies by vendor, but COE is a category that a lot of people know.
Yep. We discuss it on this podcast quite a bit.
So one of our wins was we had a COE vendor and they were getting a 3% of the eligible cases referred to them by the generalist care navigator. Once we fixed that, we basically said, okay, I'm getting all the referrals over, but people don't know about the awareness, and the trust was an issue. So we actually did a bunch of marketing and training to get that awareness up. And then the next thing that happened was people were saying, but what's in it for me? Right? So how do I justify the financial incentives? Over a 3-year period, we went from basically that 3 to 5% initial range to 15% our second year.
That's great.
And we went to 45% our third year. And we were gunning for 60, and a merger happened. So, we were back into start over mode. But, that's
Well, I was gonna guess Carum or Lantern, but it sounds like Transparent was the one you were talking about all along.
So there's quite a few of them out there. We like what we're seeing in the sense that they're able to offer local options. We're actually a big fan of, hey, if it's complex, get on a plane and send them to the best of the best. And if it's basic, find the best local doc you can find and guide them to that, that office. So that's how we think about COE.
Yeah. Management consulting can be very much black and white, profit and loss. I think healthcare is a tad different. Obviously, we're in business to earn a profit. Everyone wants, the financial outcome. But with that being said, you're also building a mission-driven company at the same time. So what have you learned personally as leading and building a mission-driven company and building that culture in such a complex space?
Yeah, what's been kind of surprising, Norm, is the 2 things that our people think about every day are how do I navigate to higher quality healthcare and how do I make it more affordable? Believe it or not, it comes down to dollars and cents. So we, at first, started educating ourselves on diabetes and all of these, so how do I manage a case? How do I manage disease? How do I manage, a specific vendor? What we have found is if you can convert everything to dollars and cents, it's just easier for people to understand. So I'll go back to that performance assessment. If I put a list of 10 options in front of an HR leader or in front of a chief financial officer, they really don't know what type 1 diabetes is all about, what it takes to manage it, or what a COE is and what it really takes to turn that wheel. But they'll look and they'll point right at, so how do I get that $400,000? Or there's a rebate error. How do I avoid that $1.2 million rebate error?
Yep.
So in the end, dollars and cents is our savior in that it quantifies how successful we are at higher quality, lower cost healthcare.
I
That's
ask
our mission.
I ask a lot of guests on the podcast, like, tell me your vision, for the next decade within healthcare. You have access to amount of data most don't. So what does the data tell you on what we can expect and what trends you think are going to stay hot or get hot? And are there any markets or areas that you think are going to cool off?
So one of the things that is novel, but I believe in, is I think there's a ton of pressure on traditional healthcare. They can't afford the bricks and mortar.
Mm-hmm.
I think at the same time, these point solutions that we talk about on the payer side are actually next generation healthcare. They're virtual, they're not fee for service, they meet you at your place of convenience, so higher convenience. So I think we're actually incubating next generation healthcare in these point solutions.
I agree.
Yep.
Especially the carve-outs, like the ones you
Yeah.
mentioned. It's like, hey,
Exactly.
provide better clinical quality, lower price, and better user, like patient experience. How does that not win long term?
Yeah, exactly. The second thing that I am excited about is if you go to your hospital, you go to your doctor, I hate this, right? I'm refilling out 3 pages of paperwork every time. I'm going to my primary care physician and I'm telling them same things that I told them 6 months ago.
Yeah.
And then if I get serious and I ask him a question, he's like, within 8 minutes, he doesn't say within 8 minutes, but I can see it in his eyes. He's like, we're not gonna be able to talk about that here. So it just, to me, it doesn't fit. It's not convenient. It's too fast. So the thing that's emerging is we have a 360-degree view of a member's health.
Mm-hmm.
I get daily updates on who they're visiting, what conditions they have, and we're getting better at pushing that out to the member so that they have it when they need it. The big barrier is I can't get it pushed into the other side of the river, into the provider space. So I have the data. If I could deliver it where it's needed, I think that would be a big change for all of us.
I think one of the greatest opportunities in digital health is the fact that hospitals do not spend any time or effort in making it a great patient experience outside of the clinical outcome. But they are not treated as a customer, a valued customer, someone they want to go to their health system for their entire life. I would argue labor and delivery does a really good job of this. And I think they know strategically, okay, if we have a family and they have an amazing experience, with the birth of their kids at our hospital, we may have them for life from that and that alone. But if it's not labor and delivery, which I've had 2 kids in the last 4 years, amazing experience with Cleveland Clinic, loved it, would recommend having your babies there, and you'll really enjoy it and feel valued and taken care of. As a patient in everything else I've ever gone to Cleveland Clinic for, I felt like a number. I did not feel like Cleveland Clinic really wants to build a strong long-term relationship with me to keep me out of UH or Metro or one of the other local, regional hospitals. So I think what we have an opportunity for as vendors in this space is to provide a better patient experience for the patient. And through that experience and word of mouth, people will prefer technology in the not too distant future for many, if not most things, and let the hospitals adjust, maybe increase their own patient experience. I think competition is always good in a free market economy. And it's going to be very clear what hospitals are going to focus on and what they're not going to focus on in the next 20, 30 years. And I'd argue they have to pare back, not do everything they're doing today, and do some things just at a higher level than they've been doing. And some of these other things can be outsourced, and that's okay. I think that is the biggest opportunity, and almost no one talks about that.
Yeah, I think so. One of the challenges, and this is a bit contentious, I believe. So I grew up in banking, which is consumer banking. It's right, customer first, and they really have done a good job over the last 20 years. Whether you go to Bank of America, J.P. Morgan, any of the banks, it's like,
and it's because they compete. It's because if you have a great experience with one and a crappy experience, like I'll give another example. As a banking client, love Chase. They've been great. They've been very helpful, even when there's been a couple things, that was challenging. They figured it out. I'm just going to say it. Fifth Third, bad experience. My mortgage got sold to Fifth Third, so it's not as even if I chose them. I thought I was signing up with Wells Fargo. Next month, hey, Fifth Third bought your mortgage, and now you're their customer. Have I felt like a valued customer in all my experiences since I bought my house 3-4 years ago? I would not say so. It's been a not very enjoyable experience. So again, even in banking, there's a pretty wide gap between the tech forward banks and some of the regional banks that aren't keeping up with the times. And again, it's a competitive market, and client experience is the most important thing in banking. I would argue it's going to get more and more important in healthcare, but sorry to cut you off.
No, I agree with you. And I talk about the great divide, the payer side and the provider side. And when I cross over that bridge, the provider side, the language instantly switches to doctor first. And the whole system revolves around a doctor as like this kingpin decision maker. I'm not really sure that's the most efficient, right? Why do I have to talk to a doctor, right? If you give me a choice, if I could get in a week from now and get something diagnosed and go on to the next thing versus wait for 6 weeks. I don't want to wait for 6 weeks. Tied to that, home, right? We know that convenience matters. So in banking, we actually know that people love being behind the privacy of their own screen versus walking in and sitting down in an intimidating chair of a branch officer's desk. Right.
It is very awkward to take out large sums of cash out at a bank. You get a lot of looks and what do you need all that cash for? It's nicer just to go to the ATM and not draw stairs.
So, I think there's a lot of room in healthcare for convenience and delivering healthcare in the privacy of the home. I think one of the issues that we need to solve is the big hospitals are trying to extend their heavy, high-cost infrastructure. And I'm like, why don't we start over? I don't need an epic EHR system, at my address, right? I got my phone. You can talk to me on my phone. If you recently had an experience with the doctors, I'm not going to renew your prescriptions unless you come in. And I'm like, why do I have to come in? She's like, well, I need to get a stethoscope on you. And I'm like, really? I have to take 2 hours out of my day just so you can put a stethoscope on me. I'll bet I could get my phone to perform that function as well. It's let's let the tech give us convenience and eliminate cost along the way. So I think that whole home health and some of these devices and the ability to continuously monitor ourselves is going to take us so much farther on the prevention spectrum than what we have to do today. I'm like, I got to go to the emergency room because why?
Yeah, very good insights. So I ask everyone who comes on this podcast, how do you practice what you preach? We live, sleep, breathe healthcare, but we're also patients, individuals ourselves. And I think we got to set a really good example, for everyone else who maybe doesn't have access to the data and information we have. So you're in a stressful job. You're CEO of a very high growth company that has the opportunity to make a big impact, that's making a big impact, with the customers you're serving today. How do you, and what are your favorite ways to reduce stress and exercise in a job where there's probably not a ton of free time in the day?
So back to that curiosity trait. I'm a bit of a propeller head. I shouldn't, I'm a farm kid, but I love tech. So I split my time between, I love landscaping and outdoor projects. And the other half of the time, I'm like on Claude or Grok right now and saying, does this flower grow in this place? Or where would I go for an image? Or what is the cost of healthcare according to so-and-so? So I'm actually having fun right now relearning some new tech when I had let that go 20, 30 years ago because I thought I was too old to embrace the tools that are emergent. So that's what I do to kind of give my brain some relaxing time.
That's great. And I think another thing that's going to be a huge determining factor of someone's health is not only like exercise and sleep and reducing stress, but also what we're putting into our bodies. And, I think there's always bad diets. There's always like the secret weight loss, solution. But I think just general healthy eating is probably like the most manageable and, best way to go for like sustained long-term health. So are there any healthy recipes in the Quinn household that you make personally or, a family member makes them regularly that allow you and the family to eat healthy, stay really, sound body and mind that allows you to perform your best and ultimately help your clients win at the end of the day?
Drink water.
All right. I drank a full liter as we're on, so I'll follow your advice.
So cut down on the alcohol. My wife and my children are allergic to American wheat, so we're a pasta-free household, gluten-free house. So if we go out, I'm like, hey, let's try Italian tonight. But I think portion size. I think one of the biggest things that we have in America is portion size are probably 2x what they need to be. And, green leafy vegetables. Fortunately, that we're wealthy enough as a nation, fruits and vegetables are, not break the bank kind of purchases. And I think the more you can bring into the house and kind of condition yourself to eat it raw, don't drink your food, all those kinds of things. I have a wife who pushes me constantly on, she tells me I got to live to 90.
Well,
we'll see.
There's a lot more clients to help and maybe a few more businesses in your storied career.
I think there's a couple more businesses.
So again, let's get this one to 100% adoption across employers and health plans, and then we'll worry about the next one. But in the meantime, we'll be following your progress at Wellnessity. Really appreciate it, John, for joining us on the Digital Health Heavyweights podcast. Keep doing what you're doing and keep up the great work. Thank you.
Norm, thanks for the invitation and thanks for the conversation and be well.
Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.